and the City of Brockton Executive Health Officer, Dr. Eno Mondesir. Today's show will focus on the stimulus benefits as well as the COVID vaccine. So the first half of the show will be with Mayor Sullivan. If you can just give us a little bit of background about how you decided to get into politics.
Sure, no, thank you very much. So I was born and raised here in the city of Brockton, a product of Brockton High School. My dad was a teacher up at Brockton High School. My wife's from Brockton as well, and we're raising 3 kids here in the City of Champions. After I graduated from Brockton High, I went on to Boston College and got my degree in political science. Then I went on to law school to get my law degree at New England School of Law. And then I went back to Boston College to get my MBA, Master's in Business Administration. Brockton is home. My grandparents came to Brockton from Ireland to work in the factories. Brockton has always been a wonderful, diverse community. So in 2005, I decided to run for city council. I had served 2 years as a volunteer member of the planning board. And I was successful to serve as a councilor at large, serving the whole city. I did that for 14 years. 5 of those years I served as the city council president. So I decided to run for mayor, and I was successful, and I was sworn in January 6th of 2020. And about a month later, we started dealing with a worldwide pandemic. And as I sit here to you today, you know, we've lost 415 residents to COVID, and we're hurting financially, we're hurting physically, emotionally, and you know, there is light at the end of the tunnel with the vaccine, but people need recovery and healing without question.
Well, we thank you so much for being with us today, Mayor Sullivan. Ordinarily, we're a new TV station that started, and normally you would expect that we would have to reach out to you, but it's been quite the opposite, where your office is reaching out to us to be on the show and to speak with our audience, and we just really want to tell you how much we appreciate that.
I want to thank you for locating here in the city of Brockton. You have a captured audience, a wonderful, beautiful audience, and Brockton is a wonderful community. So I want to just applaud you and your team, and I really look forward to participating today.
Well, thank you. So we're going to dive right into the stimulus question. So the first question that we would like answered on the stimulus benefits is, what number can your constituents call to get stimulus questions answered? Sure.
So the mayor's telephone number is 508-580-7123. Again, 508-580-7123. That's the mayor's office. You could always email me as well. It's mayorsullivan@cobma, cityofbrocktonmass.us. Again, the stimulus money is federal money coming down. We have a wonderful working relationship with Congressman Stephen Lynch. His Brockton liaison is Shana Barnes, who I used to serve with on the Brockton City Council. So if anybody wants to contact my office, we have constituent services, and we will address your issues and your concerns as promptly as possible.
Thank you. I know a lot of folks out there are wondering why they didn't receive their stimulus. I know you don't, you're not privy to each individual situation, but in general, why would some constituents not have received stimulus?
Yeah, I mean, there's really a variety of reasons of potentially why there's a delay. One is the U.S. mail has been delayed without question. Perhaps the taxes hadn't been filed 100% properly. But again, if you have expected to receive any money from the federal stimulus package, please contact my office. We'll have to get some personal information, you know, your name, your address, and then we'll work with either the state delegation, which is Senator Mike Brady, State Representative Claire Cronin, who is the House Majority Leader, State Representative Michelle Dubois, State Representative Jerry Cassidy. Those individuals all serve Brockton. And again, Congressman Lynch is our congressman. So, you know, I'll work as the mayor for everybody in the City of Champions, the City of Brockton. We are not a wealthy community. We're a great, great community. So, again, if anybody was expecting this stimulus and you feel that it hasn't come yet, please contact my office and we'll address that situation on their behalf. Okay. Another question that I'd like to ask is, if a taxpayer owes money to the government, will they still receive a stimulus? Would that be deducted from their stimulus, or is it separate and apart from owing the government money? Yeah, I mean, I can tell you, I can't give you a hard answer on the current stimulus under President Biden. What I can tell you is under the federal act that we had, the Community Development Block Grant, CDBG money, Locally here in the city of Brockton, we were given federal money during COVID to help businesses. We had business assistance programs. And I will tell you that the federal rules were that you had to provide taxes for the last 2 years. They needed to have been filed. I believe that would be the same thing with the stimulus. But I will check on that with the congressman tomorrow, and then I will post on our social media. We have our city website and our social Facebook page, and I'll definitely address that issue. But I believe that you would need to have filed the last 2 years.
All right, so everyone out there, you've got your marching orders. So another question is, how can viewers track the status of their payment?
Yeah, I mean, there is a website, right? There is the website to track it, much like the IRS, you know, when you wanted to make sure that if you indeed had filed your paperwork, and I know that that's one of your professional careers to do, and much like here locally, Secretary of State's website, if you were looking for unclaimed, you know, findmassmoney.com, you could do a tracking once you submit it. I'll tell you, in terms of the process right now, under President Biden, it's night and day compared to the previous administration. And I will say that it's going to be helpful to Brockton business owners and Brockton residents. Just last week, last Tuesday, Congressman Stephen Lynch came to Brockton. He came to City Hall because President Biden has designated Brockton one of the recipients of two recipients. One is a financial recipient under the America's Rescue Plan Act. The city of Brockton will get close to $36 million. It's $35.6 million. The really wonderful thing that the federal delegation, the congressmen and senators decided to do was that it's up to the discretion of the CEO. In this case, it would be the mayor or town managers or town administrators. But for Brockton, we're going to use that money 100% to heal. We need to rebuild. We need to pivot.
That's good. We
need to address business assistance, equality, schools, rental assistance, you know, the RAFT program as well, because a vast majority of our city residents rent. And again, I think at the end of the day, the partners in the federal level understand really how great Brockton is. They really do. Brockton is on the radar. And I know this because Brockton Neighborhood Health Center here on Legion Parkway was designated by President Joseph Biden to be a federal recipient of thousands of vaccines per week. Brockton, and Dr. Montesir is here, Eno Montesir, who heads our Board of Health, will tell you about, we get about 400 to 600 vaccines per week in Brockton. And that's first doses and second doses. Neighborhood Health Center is getting thousands that we are able to save lives in Brockton. I know that Dr. Herman and Dr. Montesir are going to talk about that, but it just shows how, you know, the city of Brockton is definitely on the federal radar, which is great for everybody.
That's great. And I know the city of Brockton has a high number of minorities, like 50.9% minorities in Brockton. And I just want to touch on something that you just mentioned, that there is rental assistance. What about assistance for landlords?
Yeah, no, so there's a couple things right now. Attorney General Maura Healey came to Brockton. We had a lot of visitors last week. We had the governor here, and Maura Healey came, and I toured with her on Thursday at Trinity Baptist. The Attorney General's office, as the chief lawyer in the Commonwealth, has designated benefits for landlords and benefits for tenants. It's really a kind of a good thing for both endeavors. I would tell you right now, under the RAFT program, which is the rental assistance, Brockton has been utilizing NeighborWorks, which is based on Legion Parkway. They're above where Harbor One Bank is, and they are administering the RAFT programs. Again, we take the Community Development Block Grant money that Brockton gets. The Brockton Redevelopment Authority, which is the BRA, led by Robert Jenkins, is the liaison. So in terms of rental assistance, a proportional share of the money is going to NeighborWorks to help our residents, our tenants. On the flip side, for business assistance, what we're doing is we're utilizing Mass Hire, which is on School Street, directly across the street from City Hall, from where I work. And Mass Hire is helping our residents in terms of business assistance, jobs, you know, really looking to try to get people back to work. The worst part of my job is at 4 o'clock. I get the sick count and death count every day at 4 o'clock, and I really yearn for the day where they call me and say, no one is sick and no one has passed. That's what we pray for. But in terms of business assistance and rental assistance, we have really good partners that are helping us do that. So again, if anybody is watching the show and you live in Brockton or you have a business in Brockton and you need anything, call my office, again, 508-580-7123, and we'll work to get you those answers.
So any special considerations for minority businesses?
Yeah, absolutely. Under the ability that we've been doing, first of all, you have to meet the standards. So it is an application. The beautiful thing about Brockton is we're such a diverse community, right? And we are what they call a minority-majority community, recognized, thankfully, by the Commonwealth. So many of our small businesses are generational, right? People that have immigrated here to Brockton, much like my grandparents did. It's just a different wave now, from Haiti and Angola and Nigeria and Cape Verde and the Latin communities. And a lot of the mom and pops, the smaller businesses, are the ones that are really hurt the most. They're also the bravest because they're the essential workers. You know, they're there every day, putting their lives on the line to really put food on the table for their families. So in terms of businesses that are seeking assistance, there's an application process. If they want to contact my office or the BRA, Brockton Redevelopment Authority, you can go on the website as well. It spells all the criteria out there right now. In terms of the first round of the money, that's already gone. But in terms of the second round, where Congressman Lynchkiss came here, that's $36 million. Now, it's not going to be all towards businesses. I have to be very blunt about that. It's going to be about a variety of things. But we have to take care of our businesses. We do.
So I've heard that, I think even with the first round, that the application process, right, for smaller businesses, it was just monumental. And a lot of small businesses did not get advantage or get any funding. What can you say about that?
Yeah, and I agree with that. It was a very, very cumbersome, informational-driven application. It wasn't a two-page application. It also was, again, looking for attestations and facts of the last 2 years of filings, of your tax filings, federal and state. It was very difficult. I'll be very blunt about that.
Yeah.
We've tried to work to first of all, address it in multiple languages. Right? It has to be in Haitian Creole and Cape Verde Creole and Spanish and English. But it also has to be much more streamlined. And I think the federal government understands that now because the way that they did it, they didn't have any ill intentions, but it was just too much.
Yeah.
So a lot of businesses that I've heard from were like, it's $10,000, it's free money, it's a grant, but we don't have an accountant right now that can help us, and we don't have a lawyer that's going to be able to vet us out. So they are trying to streamline it, and I'm really hopeful that the process will be much smoother and more people will qualify and get that money that they need.
Okay. Couple more questions for you. So just wanted to give you a couple scenarios. So one, for families that qualify for stimulus, is there a limit on payments received for large families?
It is a set dollar amount based on the taxable entities in the family. So like in my case, my wife and I filed jointly, and we have 3 dependents, 3 children. You know, now the federal government is the federal government, and they control the shots. But they have outlined in the detail. So again, if you're watching the show or you're listening to it, and you have any questions at all, my humble suggestion would be to contact our office. I am not I'm a lawyer, but I am not a tax attorney. I am not a CPA. The smarter people here do that for a living. But I will tell you that anything that I can do as the mayor, I will be ready, willing, and able to assist. In terms of the money that you are entitled to, the feds have stipulated how it will be dispersed. Some people I know last week contacted my office, and they did get it already. It was automatically put into their account.
Yeah.
But there's also people saying, "Where's my money? Where's my money?"
Exactly.
So we need to figure out exactly why the process is delayed in some cases and expedited on others.
So there's also a high immigrant population, as you mentioned. So in a scenario where, let's say, if a husband is on a work visa and he has a wife and she's not on a work visa but she's a dependent, would she qualify for stimulus?
Again, I do not want to misstate the facts on that. So I could just tell you that I'd have to put a pause on that answer.
Yeah.
Get you the right answer, and then we can report it back to you, so you can report it next Sunday.
Okay. And then another question on small businesses. If there's a small business with no employees, can such a business apply for stimulus?
Yes.
Or?
Yes. yes. A single entity?
Yes.
Yes, they can. They
Great.
can. And under the original $10,000 grant, we did have a few solo practitioners, you know, and also some independent contractors, like a barbershop that I know of, that qualified and received that $10,000. $10,000 is a lot of money.
Yeah.
And again, we need to try to figure out best mechanisms, best approach, and get money in the pocket as quickly as possible.
Great. Are there any changes going forward for taxpayers that stem from this legislation that you know of?
Not that I'm aware of, but again, if you don't mind, what I'm going to do is I'm going to take this. This will be the lawyer in me. I'll take my mayor hat and put my lawyer hat. I'm going to take this with me.
Okay.
And I'm going to vet it out with our legal counsel, the city solicitor, Megan Bridges, so that we can get the correct information, and we'll put it up on the city site. And we'll also put it on social media and get it to you for next week as well.
Thank you so much. I really appreciate all the time that you've taken to come down here and to bless us with your presence and to answer all of our questions. Thank you so much for coming down here today.
No, I want to thank you. I mean, you invited me, right? This is your home. You invited me into your home.
Yeah.
And I'd love to come back as much as you want me. It is an honor and privilege to serve as the mayor of the city of Brockton. The biggest thing that I've learned during COVID is we have to continue to work together. We have to collaborate. We have to make sure that people are treated equitable and fairly, and that everyone has a voice. And that's my mantra as long as I'm mayor. And again, I just want to thank you for your time and your efforts and your professionalism.
Well, you have an open invitation to come anytime.
I'll be back again.
Thank you.
Thank you.
All right. We'll be back in 5 minutes.
Toujours mettez masse.
Zami, kembel simple, laver monde. Corona pas une fatalité, mais chaque petit geste compte. La distanciation sociale. Toujours moins de sanitaire généralisé.
Corona toujours là. Toujours appliquer toutes règles hygiène autorité sanitaire au bail. Et un message, HMI PROMZ.
Toujours mettez masse.
Zami, kembel simple, laver monde. Corona pas une fatalité, mais chaque petit geste compte. La distanciation sociale. Toujours moins de sanitaire généralisé.
Corona toujours là. Toujours appliquer toutes règles hygiène autorité sanitaire au bail. Et un message, HMI PROMZ.
City of Brockton Executive Health Officer, Dr. Eno Mondesir. Welcome.
How are you?
I am good, thank you. So on this half of the show, we're going to focus on the COVID vaccine questions. If you can just, let's start out by, if you can just tell me a little bit about yourself and how you came on to this new role.
Sure. My name is Dr. Richard Herman, and as you said, I'm the pandemic consultant for the city of Brockton. I've been an emergency physician here in the city for the past 40 years. And during that time, I was the chief of the emergency department at the two hospitals here, Brockton Hospital and Good Samaritan Medical Center. Last spring, when the COVID pandemic hit, the mayor asked me if I would take a role with the city to serve as a consultant just to help navigate all the medical concerns that were going to be coming up. After all, the mayor, as you said, is a mayor and a lawyer and very good at that, but he's not a doctor and doesn't have a lot of medical background. And so he assembled a team of advisors, myself and Dr. Mondesir and others from Brockton Emergency Management Agency, to help guide through the pandemic.
Thank you. And Dr. Mondesir?
Thank you for inviting us to be here. I am Dr. Mondesir, Mondesir, and I have studied public health at the BU School of Public Health, and then went on to getting a doctorate in pastoral clinical counseling. And so I'm also a minister, as you mentioned earlier, of the cloth. I have worked for the city of Boston for 15 years in infectious disease. And last September, I have joined the city of Brockton as the executive talent officer.
Well, I'd like to thank you both for joining. And so I think as far as who answers the questions, these are medical questions, so I'll ask the question, and whoever wants to answer, then you can indicate. So the first question I have is, can you please tell our audience who now qualifies to receive a vaccine in Brockton?
Sure. So, as you may know, in Brockton, as in Massachusetts, the vaccine is being rolled out in phases. So in the first phase, that began a few months ago, only first responders, people who are frontline hospital workers, and then it rolled out to adults older than 75. Since that time, people older than 65 have become eligible for the vaccine, and as well as teachers and people in the education world. Starting tomorrow, which is Monday the 22nd, anyone older than 60 years old will be eligible for the vaccine. And then next month, on the 5th of April, anyone older than 55 years old. So the way this is rolled out is basically based on age. We understand that older people are more vulnerable to serious illness and hospitalization and death. And so therefore, the concept is to give the vaccine to older people as a priority, and that way those people hopefully won't get hospitalized and die. We don't want anyone to get sick, but in the younger population, of course, it just tends to be a more mild illness.
Got it. Okay.
If I may just add, along that same line, people with two comorbidities or pre-existing medical conditions are also qualified, and by April 19, the general public, including people 16 years old plus, will be eligible based on the Governor Baker and Lieutenant Polito executive orders.
Correct. So the next question I have is, where can folks in Brockton go to find a vaccine site? How would they go about that? Who would like to take that one?
Okay, well, let me start, and then maybe Dr. Herman can fill in.
Okay.
Presently, the city of Brockton has been designated as one of the 20 municipalities. So with that, there is a special consideration given to the city of Brockton, and consequently, within that plan, Brockton Neighborhood Health Center has been designated by the federal government to receive additional vaccines. And so, therefore, right now, someone can sign up with Brockton Neighborhood Health Center and go to the Shaw's Center. Not just go there, but they have to first register, and then they can go there and get their vaccines. People can also go to CVS and get their vaccines. The Brockton Board of Health has started vaccinating 75 pluses at the Brockton High School. We started on January 11 on with the first responders, and then we have shift from there to the Shaw Center as well. Presently, we have shifted a little bit to expand to the low rises, and so we're doing that, and we are looking to do some of the churches to bring some of the clinics to the churches in order to be able to help anyone who is eligible to get the vaccine. So I don't know if Dr. Herman would like to add some more.
Sure. Just the rollout of the vaccine, I'd say, was not smooth. It did not go really well because the Commonwealth of Massachusetts was unclear how many doses they would be getting from the federal government. And then the local governments were unclear how much vaccine they would be getting from the state. And so it's been a rocky process, but quite honestly, the city of Brockton is pretty lucky. Not all cities and towns are getting a direct supply of vaccine. As Dr. Mondesir said, because we are one of the 20 equity communities, that means that we have a lot of high-risk population. That means as long as we distribute the vaccine, we're ensured of getting a supply of vaccine from the state. In addition, we've got the Shaw Center. So the City of Brockton, the mayor's office, in combination with Brockton Neighborhood Health Center, has set up the Shaw Center as a local vaccination site. It's not the mass vaccination site like Gillette Stadium or Heinz Convention Center where anybody from any town can go. This is specific for people who are patients at the Neighborhood Health Center, people who live in Brockton, people who work in Brockton can go to Shaw Center and get a vaccine.
So I just want to follow up on what you just said. So just to be clear, based on my understanding is the more shots that are given, the more vaccines Brockton would receive?
Well, not quite, but the government supplies us with a total of vaccines, and as long as we give a certain threshold, as long as we're giving that threshold, like 85% of those shots, then we'll get another supply the following week. If we can't meet that supply, then they'll give it to somebody else who can meet that supply. They want to give the shots to municipalities that are able to put shots in arms.
Okay. And I have a follow-up question for you, Dr. Mondesir. You mentioned CVS and Shaw's as certain locations. Would constituents have to sign up on CVS's website and Shaw's website, or is there just like one global website where they can go and, depending on where they live, it will determine where they go to get the shot?
Yeah, it depends on where they live. So they would go call the CVS directly to sign up. And also the hospitals, people can get their shots also at the hospitals, even though the supply to the hospitals in the city of Brockton have depleted a little bit, but the hospitals, the two hospitals are considered as sites where people can get the vaccines. In addition to that, where people follow for the health care, they can also get the shot by the physician or the primary care physician.
Okay. Now the question that I've had folks ask me is, once we get the vaccine, does that mean that we don't have to wear a mask?
So that's a good question. It means you're getting closer to not having to wear a mask. Of course, once everybody or the vast majority of people are vaccinated, then we'll be in a situation where we can let our guard down and won't have to wear a mask. But as long as there's so many people out there that have still not been vaccinated, even those that have been vaccinated, like myself, still would wear a mask in public. Why is that? Well, even though the vaccine definitely protects you from getting sick and from getting serious illness and death, we're not quite 100% sure whether it prevents you from actually carrying the virus. So you may still be able to get infected with the virus and transmit the virus to someone else, even though you're not sick. And so that's why it's recommended that even after the vaccine, you still would wear a mask. Now, if you are with other vaccinated people or people in your family who have been vaccinated, then there's no need to wear a mask.
Do you have anything to add?
I think Dr. Herman pretty much covers that. I simply would say that wearing the mask is also a way to protect people who have not been vaccinated, because since they have not been vaccinated, then they can possibly expose someone who has been vaccinated. That person may not be sick, but as Dr. Herman says, the vaccines are not 100% effective. But it's the best we can have as a preventative way to keep us from being sick.
So what advice can you give me? I have some friends that do not believe in wearing masks. Like, what do you say to them?
So this is a big problem, is that there are a lot of people that don't believe in wearing masks. There are people that don't believe in getting the vaccine. So I think it really depends on how much you want to take personal responsibility for those that you care about and those that are around you, and how much you want to take community responsibility for the community at large, both in Brockton or just humanity in general. The idea is that I feel that everyone has some kind of personal responsibility to not spread this illness. Why? Because we know that it kills people.
Yeah.
And I think that your job, if you know people that don't want to wear a mask, is to stay away from those people. Clearly, you do not want to be a close contact. You do not want to be within 6 feet for more than 15 minutes of any other human being who could possibly have the virus. I think there is an enormous amount of reluctance, especially in the Haitian community, as we've seen in Brockton, for people to get the vaccine. They are scared of the vaccine. They don't trust it. They don't feel that it's could possibly be safe because it was developed so quickly. They are worried about the side effects. They're worried about the long-term side effects. They're worried that it can affect your DNA. All of those things are not true. It is a safe vaccine. It's been given to over 100 million people. The kind of vaccine that's been given, the Pfizer vaccine and the Moderna, is a kind of vaccine that's been used for more than 10 years in animals and humans with no long-term side effects. It cannot give you COVID. It cannot change your DNA, and is a very, very safe vaccine. And so that, to me, is a bigger issue right now.
I agree. Next question I had was, what's your assessment of when normal life can resume in Brockton?
Well, that's a tough question because it really depends on the path of the virus. Right now in Brockton, we had a surge last spring, we had a surge this winter, and now things are coming down. But they're not coming down really, really low. They're coming down and leveling off to about 20 cases or more a day. In fact, they're starting to go up a little bit now over these last several days. And so when things go back to normal will really depend on the path of the virus. On the one hand, the virus wants to get you. It's out there, it's developing variants, which are forms of the virus that are more infective, so they have a higher rate of infection and may even have cause more serious illness. And they're going to find a way to get you.
Yeah.
On the other hand, we've got these powerful weapons, wearing a mask, keeping our distance, and the vaccine. So it's really going to be a question of which one's out. Is the virus going to get you first, or are we going to be able to quickly get enough people vaccinated to protect us against the virus and its variants? If we do that, if we are able to get the vaccine into enough people's arms over the next month or so, then I'd say that it would be a reasonable hope that by the 4th of July things could seem closer to normal. The problem is, of course, we still have the whole universe of children. Okay, this vaccine is only approved, one of them for 16 and up, one of them for 18 and up. And so we've got the kids who are in school, possibly spreading the vaccine and spreading the virus amongst each other. And we have to wait for those trials to be done so we can vaccinate the kids. So I would say I'm hoping that the 4th of July starts to look normal, but by the fall, for next school season, that's when I'm hoping that things can get back to normal.
Do you agree?
Oh yes, absolutely. Because even though President Biden mentioned that by May he would like to see mass vaccination and everyone could get a vaccine. However, we do know that the supply has not met the demand, and I'm not expecting the supply to exceed so much that everyone will get a vaccine. And even that, even if there were the supply, we also have people who are hesitant, and those people may not get vaccinated until some point later in the epidemic or the pandemic.
Okay. So what are the possible side effects of the COVID vaccine? If everyone who should get it by, I think it's April 19th, you said is the deadline, or at least the goal, what are some possible side effects that we have to worry about?
So in general, the side effects of the COVID vaccine are similar for each of the 3 kinds of vaccine that are available now. For the vaccines that are 2 doses, which is the Pfizer and the Moderna vaccine, you get them either 3 weeks apart or 4 weeks apart. After the first dose, usually there's not significant side effects. You might have soreness in your arm, and then the next day you might feel slightly ill. Ill like you might be coming down with something, like maybe fever, body aches, just not feeling well. And usually those symptoms are very short-lived, not more than a day or 2. Some people have no side effects at all. Some people, the side effects last for a couple of hours. After the second dose, it's more likely to have those side effects, but they tend to be very, very mild and usually don't need any kind of treatment. Sometimes take some Tylenol for the aches and the symptoms go away.
Okay. Do you have anything to add to that?
My wife took the second dose, and this after 48 hours, she got a fever of 101. Now, a fever is normal because your body is reacting to the vaccine. And so, therefore, for instance, when you talk about the body reacting, it's not always a bad idea to have a fever, because it means that your body is fighting something or is recognizing that there is something foreign in your body. And so, therefore, similarly for the vaccine, when people take it, a few people after the second dose, they have an increase in fever, but it short-lives.
What is your opinion on the efficacy of the Johnson & Johnson shot? Like if someone had a choice to take between the Moderna, Johnson & Johnson, which would you prefer and why?
I would say take any vaccine that is offered to you. All of them are completely effective at preventing severe disease and death. I know that the Johnson & Johnson vaccine got a little bit of a bad reputation when it first came out because it wasn't as high as the 95% efficacy of the other 2 vaccines. Well, it also was tested at a time when there were more variants that were out there, and had those other 2 vaccines been tested at the same time, they might have had the same level of efficacy. But when tested against not just infection, but hospitalization and death, the Johnson & Johnson vaccine is as good as the other ones. So I would say most of the time, you're not going to have a choice right now. You're going to go to a center, and they're going to get whatever they've been given by the government as their supply. And I would say if you have a choice to get a vaccine, no matter what it is, take it. That is your ticket to good health. I would advise my family member, if they get a chance to take the Johnson & Johnson vaccine, to take it. Of course, the advantage of the Johnson & Johnson vaccine is it's only 1 dose. And so you take it and you're done with it. With the Pfizer and the Moderna, you have to get a second dose, as with the AstraZeneca vaccine that hasn't been released yet in the U.S., but you would require a second dose.
That's what I love about the Johnson & Johnson, because I hate having shots, and just the thought of just having the one,
Right.
I-
It's
you
very
know,
good
that
for
would be
people that have
preferable.
needle phobia.
like me. So another question I had was the AstraZeneca COVID vaccine was temporarily banned in some European countries due to blood clots. How is the AstraZeneca vaccine different from the vaccines available in the United States?
Right. So the AstraZeneca vaccine is a viral vector vaccine. What that means is it's very similar to the Johnson & Johnson vaccine. So the Moderna and the Pfizer vaccines have a tiny little bit of RNA, some genetic material, wrapped in a little fat bubble and gets injected in you. The Johnson & Johnson and the AstraZeneca have an actual piece of the virus's DNA put inside a modified virus, the kind of virus that might cause the common cold. But that virus has been engineered so it doesn't infect you, it doesn't make you sick. It's just a way, it's a vector, it's a way of getting that piece of DNA into your body. And that piece of DNA is not for the whole virus, it just forms a little protein. So it allows the body to make antibodies against the protein that's on the surface of the virus. So they all end up working the same way, which is they have some genetic material that instructs your body to make a protein, and then the body makes antibodies against that protein. So they all work basically the same way. Now, the AstraZeneca vaccine has been approved in, I don't know, probably 40 or 50 countries right now. It did pause because there was some concern, about blood clots. But I think that there was enough evidence that they did not find that the blood clots were related to the vaccine. There was not a cause and effect, and so the vaccine again was resumed in all of these countries.
Okay.
And also, this is a two-dose vaccine. You have to take two. The only thing is that, contrary to Pfizer and Moderna, it's from between 8 and 12 weeks that you take the second dose. It's a little bit longer.
Okay, another question I had was, we've got our programs in the U.S., there are different programs in Europe and other parts of the world. Shouldn't we be focused on global inoculation? Because if everyone in the United States is inoculated and not everyone in third world countries, then we can still have, more variants emerging. And so what is the plan for that, if any?
So I'm not that familiar with the entire global plan for immunization. But I can tell you that the first step was getting back into the World Health Organization. So the World Health Organization is kind of the role model and leader of global health around the country. And the United States left that organization, but when Biden became president, we rejoined and now play a role in the global health scene. Obviously, the three vaccines that are available in the United States are only 3 of dozens that are being developed around the world. And China has vaccines, Russia has vaccines, Europe has vaccines. They're available, and I know that the United States is going to be providing or selling, I'm not sure what the relationship is, hundreds of millions of doses to other countries around the world.
Now, I would add that one disadvantage with Pfizer and Moderna for countries, let's say Haiti. The reason I picked Haiti because I'm originally from Haiti, and I also have an organization called Agape Global Health for Haiti. We have clinic there. This week I was asking the physician that we have at the clinic, what's the plan of the government in Haiti for vaccine? And she told me, we're not too sure, but the government has issued a letter whereby people who want to take the vaccine, if there is any issue, health issues or hazards, they cannot sue the government. But the Pfizer and the Moderna, they would not be as effective taking them to Haiti because of the requirement for refrigeration, because there are places where electricity does not exist. Johnson & Johnson is much easier transported. I don't know about the AstraZeneca, what the real requirements are for transporting, but for those three in the U.S., I think Johnson & Johnson would be one that would be more manageable if it were made available to other countries, so other developing countries.
Okay. So the final question I want to ask that is Brockton specific are what processes or procedures have been implemented in Brockton to fight COVID and to take Brockton off of the hotspot list for COVID infections?
Well, let me take part and I'll leave Dr. Herman with some part.
Okay.
When I joined, I found Dr. Herman was already with the mayor, Mayor Sullivan, fighting the virus. And so therefore, there was some strategy being developed and implemented. People still get exposed, who get sick, get infected. We still do contact tracing. And so therefore, once someone is infected, we still have in place contact tracing to make sure that these people, they observe the protocol so that they do not expose other people unnecessarily. And the numbers continue to go down for weeks now, bringing Brockton back to yellow again. And so we're looking forward to make sure that we can mitigate the epidemic so that we can keep going down, probably from yellow to green. And I know Dr. Herman, he likes the statistics. He plays with it so much to see what next day or next week, what color we will be in. And so we do that. And then the vaccine is another way to make sure that we get more people vaccinated. And because once you're vaccinated, you should develop immunity against infection.
Thank you.
Well, I would just add that I think that tackling the COVID pandemic has been the primary 24/7 focus of the mayor's office in the city of Brockton. I think that from the beginning of the pandemic, the mayor recognized early that it was going to require an all-hands-on-deck approach, that everybody was going to need to be involved. And so we have the communication infrastructure where his leadership team talks with the hospitals twice a week, with the religious leaders and pastors in the community once a week. We involve the homeless shelter, the neighborhood health center, the nursing homes, lots of ongoing communication to figure out what best strategies we can employ. Right now, we have the vaccination program that's really up and running quite smoothly. And I think that for those who have not yet been vaccinated and are in need of personal protective equipment, the city has a vast supply available to it. And I think if you called the office, the mayor's office, you could request PPE if you needed it. So
Great.
I think we're going to continue the outreach to some of the communities who are resistant to getting the vaccine and trying to get those folks to buy in, because as Dr. Mondezier said, right now there's not enough vaccine for the people that want it. But pretty soon there will be. And the issue won't be getting the vaccine to the people that want it. It will be getting to the vaccine to the people that don't want it. And that's where our focus is going to shift to.
Well, that's been some very interesting and very valuable information that we've received this week. I'd like to thank all of my guests. Special thanks to Mayor Sullivan, Dr. Richard Herman, and Dr. Eno Mondesir. Thank you so much for all of the answers that you gave to the questions. And if anyone out there has any additional questions, feel free to get in touch with the mayor's office. He said that he would gladly come back anytime to answer our questions. And we really appreciate you, Mayor Sullivan, for coming today. Thank you, guys. See you next week.
Toujours mettez masque.
Amis, Campbell Saint, lavez le monde.
Corona pas une fatalité, mais chaque petit geste compte. La distanciation sociale. Toujours moins de sanitaire dans la valise.
Corona toujours là. Toujours appliquer toutes règles hygiène autorité sanitaire au bail. Et un message HMI PROMZ.